Thanks for joining today for our Medicare webinar. My name is Stephanie DePaco. I'm the Vice President of Insurance Services here at PayEntry. On the call with us, you met Dina, our wonderful VP of Marketing, who put all of this work together for today's webinar. Joining us also to present today is Sarah Narvakin, who works with me at PayEntry, and Amy Johnson with My Benefit Advisor, who's going to be doing the Medicare presentation today. So first off, I would like to introduce the PayEntry partnership with My Benefit Advisor. Us at PayEntry as group insurance brokers, we have groups that who have employees that are Medicare eligible all the time. As everyone knows, Medicare is not simple to navigate, at least not for us. So we believe that My Benefit Advisor is going to be a great resource for our clients. Amy's going to do a quick overview of Medicare, how their services can assist. And then we're going to have a quick Q&A session, and then we'll follow up with an overview of our PayEntry insurance services. So I'm going to go ahead and hand it off to Amy, and she can start her presentation today. Thank you, everyone.
Fantastic. Okay. Thank you again, Stephanie and Dina and the PayEntry team for inviting our agency to be here today. We're really excited about the partnership. My name is Amy Johnson. I am one of the national sales leaders for our My Benefit Advisor Medicare team. I have been in the industry for just over 20 years, and I'm also a former selling agent. So in an effort to keep us on time today, I will just dive right in. Again, we thank you for your time in advance. I'll buzz through these first couple slides fairly quickly, and then we'll get into more of the core of the session today. So our agenda, our purpose of the session is to demonstrate the value that My Benefit Advisor can bring to you and your employees. Our goal is to leave you with a better understanding of the coordination between your employer group plan, COBRA, health savings accounts, and of course how these plans interact with Medicare. I'll also share details regarding the new reporting methods. These are specific to Medicare Part D and credible coverage details. So we'll talk about that. And again, thank you for your time, and we'll keep on going here. As Dina and Stephanie mentioned, I think it's safe to say that Medicare can indeed be confusing, right? With its complicated rules, wide array of options, not to mention the alphabet soup of plans. So a little bit more about us. Who is My Benefit Advisor? We are an agency that provides general education, consulting, and assistance with enrollment in Medicare plans. So we are very consultative. We are not a call center. Our team and our agents really take great pride in that. Our agents are highly trained, they're licensed, they're certified, and I think where they really shine is when they're working with individuals one-on-one, and that can be done at no cost. We can offer strategies that will work to reduce an employer's cost, minimize compliance risks, while of course increasing the overall value of every employee benefit package. So in the slides to follow, we'll discuss, as we mentioned, what employers need to know about Medicare. For employers, these are topics as we talked about: Medicare secondary payer rules, COBRA, HSA plans, how that all works with Medicare, as a value-added service to both employers and employees. I mentioned we can provide no-cost educational meetings. That's for staff, their family members. I think that type of support will really enable an employee to make better informed decisions about their healthcare options. On the employee side, we offer further education of all Medicare plan types. So that's that consultative piece that I had mentioned. We offer unbiased plan recommendations and ongoing support. So when an individual works with one of our agents to enroll in a plan, the agent isn't walking away after that sale, right? We have a service team to assist that person ongoing with those day-to-day service requests or any escalated issues that might come up, from time to time with the insurance carrier. We have our own quoting and enrollment platforms. We provide assistance in all 50 states. And again, there's no charge to the employer or the employee for our services. Okay, so let's get into more of the fun stuff. So let's just take a quick step back so that we understand what Medicare is, right? Medicare is a government-run health insurance program. It's available to US citizens and legal residents who have lived in the United States for at least 5 consecutive years. Now, to be eligible for Medicare, a person must be 65 or older, or if they're under age 65, they've received disability benefits from Social Security or the Railroad Retirement Board for at least 24 months. Or they've been diagnosed with end-stage renal disease or ALS, which is Lou Gehrig's disease. If it's your first time signing up for Medicare, you can apply either online, in person, or by calling Social Security Administration. I think what gets confusing for folks here is that you're calling Social Security to apply for Medicare. You're not calling the Medicare office, right? You're not calling the Center for Medicare and Medicaid Services. Instead, you're enrolling through Social Security, which doesn't mean that you have to start collecting Social Security retirement benefits. So keep that in mind, that Social Security retirement benefits and Medicare benefits are separate, okay? So let's talk a little bit about Medicare secondary payer rules. So Medicare secondary payer rules are designed to determine when a plan pays first or second for healthcare services. Now, Medicare is the primary payer for individuals who are over 65 or for individuals with certain disabilities, such as end-stage renal disease. So that coordination works different when you've got a person under age 65 qualifying for Medicare due to a disability or qualifying for Medicare due to end-stage renal disease. So it's important to know when other plans may be primary, with Medicare being the secondary payer. So how does this all work, right? So if an employee or their spouse is 65 or older, and let's say we've got one person as the active employee and the spouse covered as a dependent, and the group health plan coverage from their employer is, let's say, credible coverage with more than 20 employees, the employer group health plan is deemed primary and Medicare is secondary. Now, if the employer has less than 20 employees, and this is just people, belly buttons, not number of folks covered under the group health plan. So if the employer has less than 20 employees, again, this is reversed. Medicare becomes primary, and the group health plan is secondary at that point. I mentioned that the coordination is different for those who are eligible for Medicare due to a disability or end-stage renal disease. So this is a confusing topic, but it's really important to understand. I think that by understanding these rules, employers can and benefit administrators can ensure a better coordination of benefits, better claims processing, accurate claims processing, and of course compliance with Medicare's regulations. Okay. This is a lot of content today. So again, let's submit any questions in the chat and we'll go through them as Dina mentioned at the end. So COBRA and Medicare. So when you're eligible for Medicare and covered as a COBRA participant, Medicare will be the primary payer of medical claims. So this is important to understand, because this means that a person must enroll in both Part A and Part B of Medicare to avoid a gap in their coverage, even if they're electing COBRA. Now, if you're eligible for Medicare, prior to the date you elect COBRA, this will enable you to retain your COBRA coverage generally for the full duration. Now, if you become eligible for Medicare while you're covered under a COBRA plan, this will generally result in the termination of your COBRA coverage. When a person leaves employer coverage, they have an 8-month special enrollment period to elect Medicare Part B without a penalty. So the special enrollment opportunity ends, after the 8-month window and that special enrollment period ends, a person would have to actually wait until the general enrollment period to sign up. The general enrollment period takes place between January 1st and March 31st of each year. And typically when someone enrolls in that general enrollment period, it also comes with a penalty. So there's a 10% Part B penalty for each 12-month period that Part B is delayed, even if someone elects COBRA. So I think the important takeaway here is to keep in mind what we just discussed, that Medicare is always the primary payer, right, to a COBRA plan. And if you delay Part B in that 8-month window, again, your COBRA plan may not pay as much as expected. This is referred to as a COBRA trap. And again, you might miss that opportunity to enroll in Medicare Part B using that special enrollment period. And I can't tell you how many employees I've talked to firsthand who've experienced this. So I think, as I mentioned, that this is a very important slide here of information. Okay. All right, so let's keep going. If you're approaching Medicare eligibility, you'll want to plan ahead, right, to avoid any fines or penalties as it pertains to a health savings account if you have one. So this will include decisions about when to enroll in Medicare and decisions about when to start collecting Social Security retirement benefits. If you enroll in Medicare Part A or Part B, or if you're automatically enrolled in Part A by Social Security, which happens, and folks may not even know that they're enrolled. Let's say they started collecting Social Security, now all of a sudden they're enrolled in Part A. All contributions to an HSA must stop, including contributions made by your employer. These contributions should stop the month that Medicare begins if you sign up at age 65. So again, enrolling in any part of Medicare, Part A, B, or D, results in your loss of your right to make new contributions to an HSA and could result in a tax penalty if new contributions are not made and corrected prior to the income tax filing deadline. Now, this is where it gets a little bit more confusing for folks. If you delay Medicare enrollment and continue making HSA contributions while you're covered under a qualified group health plan, you'll have access to a Part B special enrollment period when coverage stops or when you retire. So you wouldn't be subject to a Part B late enrollment penalty in that scenario. However, when you delay Medicare at age 65, keep in mind that your coverage will be made retroeffective under Part A, not going back further than the month that you originally became eligible for Medicare. So if you delayed Medicare, you'll want to stop contributions at least 6 months prior to signing up for Medicare. And this is prior to the effective date of your application, not the effective date of Part A. So think through that. Withdrawals from your HSA after Medicare enrollment, of course, can be used to pay for any medical expenses, such as deductibles, your co-payments, your co-insurance, and even certain premiums. Medicare Advantage plan premiums can be paid with HSA dollars. Part D premiums can be paid using HSA dollars, and so can your Part B premiums. So like I said, you can still use the money, but the takeaway is that you're not able to put the new money in the HSA if you're enrolled in any part of Medicare, and that 6-month look back. Okay. Um, so let's talk about Medicare Part D and how to determine if your plan is credible or non-credible. And again, this is specific to the prescription drug benefits as part of your medical plan. We probably all know part of the Inflation Reduction Act of 2022 made improvements, right, to Medicare's prescription drug plan benefits starting this year. Um, of course, when that happened, CMS acknowledged that due to the improvements, some of the group health plans that were offering prescription drug benefits that once met that Part D credible coverage requirement might no longer meet that requirement beginning this year. However, CMS did decide to still permit use of what they call the simplified method, which is how employer groups can determine credible or non-credible status for this year. Now, this landscape changes right for next year. The CMS has recently released final instructions that address the redesign changes. Now for 2026, group plans will be permitted to use either the existing simplified method, or I'll show you the revised simplified method, or there's an actuarial determination method as well that can be used for 2026. Excuse me, I'm just going to take a quick drink here. Lots of talking. And then for 2027, CMS has indicated that it does not intend to continue using the simplified method. So if that position is finalized, groups would need to use either the revised simplified method or the actuarial determination method for 2027. So I think more to come on that. As an employer, what are you required to do? You'll want to work with your plan administrators, your brokers, right, or the insurance carrier to determine and understand if your plan is deemed credible or non-credible. If a change in status occurs, an updated notice must be provided to CMS within 30 days of the status change. A notice should also be sent to plan participants within the same time frame. Okay. And then I'll also just point out, so folks who are eligible for Medicare cannot have more than a 63-day break or lapse in their Part D credible coverage to avoid a Part D penalty. So there's penalties under Medicare Part B if someone doesn't apply on time, and there's also penalties under Medicare Part D. So I think it's important to note that piece too, okay? So more about the revised simplified method. The 2026 instructions revised essentially the parameters of the simplified method to better reflect actuarial equivalence with the enhanced Part D benefits for 2026, which included, the $2,000 cap, for example, in out-of-pocket spends. Now, these changes also included adding coverage of biological products, eliminating requirements related to annual and lifetime benefit maximums, eliminating requirements related to an annual deductible, and increasing the payment threshold from 60 to 72%. Okay, I feel like I'm kind of flying through this material here. So I think we've covered a lot of ground. Let's review some of the most frequently asked questions. So these are questions that we're seeing every day from both employers and employees as they're approaching Medicare eligibility. I think a big one and perhaps a misconception is, who is automatically enrolled in Medicare Part A and B? So we talked about this a little bit already, that anybody who is 65 or older and already receiving benefits from Social Security, or someone who's considered disabled by Social Security, or anyone with ALS. So those are the categories on when someone would be automatically enrolled in Medicare. Remember, we talked about the three ways to self-enroll in Medicare if you're not in that category, right? Um, and then a couple other hot topics are the penalty piece. Is there a penalty for not enrolling in Medicare while I'm covered under a group health plan? Generally, that answer is no. As long as you or your spouse are covered under a large employer group health plan, more than 20 employees, your plan is deemed credible. Um, you could delay both Part A and Part B of Medicare in that scenario and not risk the penalty, right? And then what happens if an employer plan does not have credible coverage? An employee could go out and secure their own prescription drug plan in the market. Now, in order to do that, they would also need to enroll in at least Part A of Medicare, which is the premium-free Part A of Medicare. All right, so just a few more frequently asked questions. How does someone compare their options if you lose employer coverage? Or what happens, if I suddenly lose coverage? We can help, right? There are many moving parts, I think, involved in that type of decision. Obviously, a person would want to compare the scope of benefits on either side, preventive care benefits, mental health care benefits, what their specialist visits or co-payments would look like. I think it's very important to compare network options on either side. Um, and remember, this is where our team and our agents are best suited to assist you. So I'd encourage everybody to reach out to me, and we can get you started with a licensed agent. Um, we talked about that last one a little bit. What happens when a person who is Medicare eligible loses group coverage? We talked about the 8-month special enrollment period to sign up for Medicare Part B without a penalty. Now, note that that person only has 2 months to enroll in a Medicare Part D or Medicare Advantage plan following the loss of group coverage. So there's so many different windows of when can I enroll or when can I do something. So it's really important to understand how this all works and talk to our team, lean on us. All right, so these are just a few testimonials, what employers and employees have shared with us after working with our team. I won't bore you guys with reading each one of these, but I'll just highlight a couple. So this one comes from an employer group. We wanted to drop a quick line letting you know how pleased we were to work with Tracy for all of our Medicare plans. She's very knowledgeable and patient. She took the time to make sure we understand all of our options and helped us select the best plan for our situation. So again, I think that's really speaks to the value of working with a Medicare agent. One more, the meeting was great. Erwin did a fantastic job presenting. We received several comments of thanks from the attendees. The content and pacing was perfect and allowed for good questions and discussions. We're looking forward to the next session next week. So again, I feel like I went really fast. My contact information is here on the slide. I thank you again to the Pay Entry team for inviting us to talk. And I'll hand the mic back over to, I think Dina is going to take us through any Q&A questions.
We do have a few posted in the chat already. And this one was for you, Amy. During your presentation, there was a question that came up from Sharon asking if you were referring to full-time equivalent employees or the actual number of employees.
Great question, Sharon. So we're just talking about belly buttons. So it doesn't matter if the person is full-time, part-time. We're just actually counting people, right? So if your employer group has more than 20 people working for that company, um, that would mean that your group plan would be primary and Medicare would be secondary for that employer group. That's a great question.
There was another question. This is from David. He said that this is a very complex subject matter. Are you available for presentations to companies of a specific size?
We can talk to any size employer group, large or small. It's another great question. Yeah.
Terrific. So you'll arrange a webinar like we did today for other business owners to share with their employees.
That's right. And that could be, a hybrid of this conversation, right? It could be perhaps more of a 101 for employees, diving perhaps deeper into different topics that I think would, more pertain to that audience. But absolutely contact us and we're happy to talk about those presentations and getting something like that set up for your group.
I have another question. This is from Denise, glasses back on. For Amy, the designation for employer at 20 plus, is that for a calendar year? And if so, when is that determined?
That is a great question. So I'd actually like to take that offline because there's actually a little bit of a complicated method that determines that. And it's specific to either growing over 20 or dropping under 20 and when that occurs in the calendar year. And it also has to do with reporting to CMS. So I'd like to just take that question offline.
Thank you. This next question is for you, Stephanie and Sarah. This is from Jody, and Jody is saying a little bit of off topic, but we're preparing for open enrollment season. How do I get in touch with you, and do you have anything that you can do to help us with that?
So Dina's going to share our contact information. We can actually get in touch with you and speak with you regarding our services after this call. All right, go ahead, Sarah. Thank you. Thanks, everybody.
All right, so we had a great question come in regarding our services. We do offer a full service brokerage here at PayEntry. We are a division of PayEntry. And the benefit of that is that we are tied to the payroll company. So not only do we offer the full service of taking your benefits to market and doing all the carrier changes and making sure all of that flows great and nicely with our PayEntry payroll platform, but we also get to partner with great vendors like our My Benefits advisor who's joined us today. And we have many clients who feel like this creates a very seamless, that's the word I was trying to look for, seamless transition for all of your benefit and payroll services. We know many clients are preparing for open enrollment during this time. We really pride ourselves on being very customer oriented. We spend a great amount of time with our clients one-on-one. They reach out to us. We usually return phone calls and emails within an hour or two. And we really help to understand and listen to our clients so that we know what you're really looking for when it comes to benefits. And we do have a broad range of benefits that we offer: medical, dental, vision, voluntary worksite benefits, including things like pet insurance and legal shield as well. We do offer a benefit platform that we put our clients on. That's a great opportunity for the employees to be able to see what benefits they have and make their selections with an educated, outline available to them. And then that platform feeds into payroll so that there's no manual entry for deductions and fringe. We have a integration for workers' compensation as well with another preferred broker and client of ours, or not client, partner of ours. And we offer many network resources again with vendors such as My Benefit Advisors. So if you haven't had someone take your benefits to market, we'd be happy to do a overview or review, I guess, of your benefits and insurance, and see how we could help you improve your selection, as well as maybe you don't even have benefits yet and you're not offering those. We'd be happy to walk through that process as well. And we do provide ongoing support to all of our clients. So we would, again, be available for any questions your employees might have. If we don't know the answer, we'll get the answer for the clients and the employees. We do all carrier changes. We do periodic audits to make sure what the employee has enrolled in is correct with the carrier and is correct on the payroll side. So if you have any questions about insurance benefits, we're happy to assist.
Thank you so much, Sarah, Stephanie, and Amy. Thank you to everyone who took the time again out of your day to join us for this Pantry webinar about Medicare. We do have Amy's contact information for you here if you want to take a snip of that. And of course, our contact information for Stephanie and Sarah. They are our insurance services team that help our clients on a daily basis. You have anything else to add, Stephanie? I'll turn it over to you for goodbyes.
Thank you, everybody, for joining us today. We look forward to hearing from you if you need anything from us. If you did not get Amy's contact information, we're more than happy to share that as well. But I appreciate your time, and thanks, everybody, for having us today. Appreciate it.